Hi, I'm Antriksh. I'm the founder of Adyant Health. I teach Ayurvedic acupressure and I practice Ayurvedic acupressure, Marma, and auricular therapy. So, today we're going to talk about an ailment that usually worries us almost all our life, and that is cervical spondylitis, or neck pain, which is chronic. So, today we're going to talk about how we can treat, and in reality, treat cervical or cervical spondylitis through an ancient system of Marma. Now, this system dates as old as that of Ayurveda itself, and its foundations are in the principle of applying pressure in certain regions which are dense in energy, which helps us unblock those energy channels and heal us from the core. So, Marma, as we understand, is a network of energy that runs across the body, and we can heal our body not just through medicines but also by applying this pressure on those energy points. We call them Marma. Okay, so we're going to discuss 3 Marma locations which are extremely beneficial for treating cervical pain of any kind, either acute or chronic. So we're going to start with Marma location number 1, which is called Shipra. Now, Shipra is found on the juncture of the thumb and the index finger. So when you come from here, you trace this bone and the bone of the thumb, and where they meet, this entire location is relatively fleshy in touch. So the Marma location is here, right here towards the thumb. So when you press it, the stimulation would be from the thumb of the other hand and not through the finger. So for demonstration purpose, I'm showing it like this, right? So this is the area that we're going to press. Now there's a particular order and there's a particular, you can say, rhythm to pressing this region. Now the pressure would be like this: so press, release, press, release, press, release. We do this 15 times. Now, once you are aware of the location of this Marma, you can relax and easily keep the hand on your legs, on your thighs, or let it be like this. So how I'm going to do this is like this. So press, release, press, release, press, release. This is the pace we're going to continue till 15 times. Another important Marma location is called Manibandha. Now this Manibandha is on the joint of the wrist, on the upper part of the wrist in the center. So the way to stimulate this Marma is by holding the wrist with the thumb and the middle finger. So you form a ring around the wrist, okay, around the wrist. Notice that all other fingers are not touching the wrist, because the purpose over here is to rotate the wrist. If you hold it like this, you won't be able to rotate it. So ensure that only the thumb and the middle finger are forming a ring around the wrist. Now, since this is the Marma, we hold it like this and then slowly rotate the wrist, first clockwise 10 times, and it has to be very slow and gentle. It's not necessary to strain your wrist because it might pain otherwise. Do it as comfortably as you can, and then anti-clockwise 10 times, maintaining a firm pressure on the wrist region. And then we do the same for the other arm. So clockwise 10 times, then anti-clockwise 10 times. Now another important Marma sthala or Marma location for cervical is called Amsa. And to locate Amsa, you put your hand like this near the shoulder blade. So this is the shoulder blade. So my arm would touch the shoulder blade and slightly overshoot this distance of the finger from the shoulder blade, while your thumb is over here. So this is how it is going to be, and I'll show you from the other side how it looks from the back. So notice my thumb is touching the neck and the index finger is touching the curvature of the neck over here, and you can see the fingers are only slightly overshooting the curvature of the shoulder blade. So we maintain the same rhythm as we have done with the Shipra, and we press it in this manner. So 1, release, 2, release, 3, release, 4, release, and like this we continue till 15 times. Okay, so now that we have seen the Marma points, it's important to understand some guidelines related to Marma. So men would start stimulating the Marma points starting from the right side, and women will start stimulating their Marma from the left side. So for example, if I'm stimulating Amsa, so I'll start from the right side. Once I've stimulated that 15 times, I'll switch over to left side. If a lady wants to do that, they would start from left side and then switch over to the right side. Similarly, every Marma will be started according to the gender, left and right. So I'm looking forward for your feedback. I hope it really helps anyone who is in pain and in trouble. This system has helped many people across the world, and I hope it helps for you as well. Thank you and take care.